So, evidence, what is it? I tried to find the most neutral definition of evidence. So I went to the legal world. You know, so I know in clinical practice, we don't necessarily speak in facts the way you normally hear in science and in litigation. But what I liked about the definition, and especially the asterisk about the objective truth. So if the research that we've done, whether it's real quantitative, qualitative, if it's done properly, if it's done objectively, it's reproducible, all the other IRB terminologies that escape me right now, then it is something that we can say, okay, this intervention is effective. This intervention is of low value and should be de-implemented. So we go find new evidence and find something else to re-implement. This particular staffing model is effective or ineffective. How do we change that? So those are some of the, at least what I'd like to think of, the objective truths that exist within healthcare, especially in the nursing world. I listen to the clinical practice committee twice a month, and I'm just in awe of all the information needs that I hear over that 2 hours of time. But of course, realistically, it's hard to pursue those. And we've known that through 40 years of research in information-seeking behavior, that it's almost impossible. I mean, there could be like 1 to 7 information needs per patient, but half the time, neither of those are pursued. So yes, we're trying to figure out, one, we have the needs, how do we fulfill the needs? And then how do we bring it to the clinic? How do we bring it to the administrative level when it comes to models of care or even staffing levels as well? So evidence is everywhere. I hear it, in so many aspects around the medical center, and trying to figure out how that fits within the ecosystem. Because a K card is an information artifact, not to get too information sciencey here, but that's an artifact that a person made to try to bring about quality improvement. A policy which may come from the literature becomes a policy, then it becomes an SOP. All of that's part of your ecosystem. It's not just the BPA. It's not just the alert that tells you anything about adverse events. There's so many aspects of evidence that fits within the ecosystem that we don't necessarily recognize, okay? So, as I mentioned, and this is also part of my master's thesis, I've been following the ecosystem for a long time, and going from the print to the electronic age, and there's a good bit out there when it just comes to the practice and the scope of evidence-based practice. And I know, as my co-author has told me many times, nurses don't practice medicine. But I put EBM up there just for a little bit of context. But looking at and this is very, very crude searches of mine, but looking at evidence-based practice, and this is all from PubMed, evidence-based practice in nursing and evidence-based nursing, you can see how the numbers dwindle so much. Yes, that's a call. I think yesterday there were several times there were calls to action made on how we need to improve our evidence base, whether it's your quantitative research, but also your descriptive research, because we've got to get that qualitative aspect as well. We've got books, we've got articles, we're here at conferences, but we really have to find ways to try to improve this base.
Yeah, no, I agree. And what we have found as we've been searching, and I think that for all of you in the room who are informaticists, we now have a growing body of literature within this specialty that we don't do enough to go in and find when we're implementing technology, or we're implementing a new service, a new application, a new workflow. without going in and really seeing how it's been done before. So we're getting more of that published now in the literature. We haven't done very much, as Philip mentioned, very much rigorous evaluation, so good, systematic research around what it is that we do. We need to do a lot better job at that. But what we have is a pretty good number of descriptive work, case studies, things like that. And when you pull that together and synthesize it as a whole, you can come up with some pretty good recommendations or some pretty good ideas for how something should be implemented or evaluated.
So as I've continued the journey amongst this ecosystem, I've been thinking more and more and more as you begin to read and how the language changes, how the approaches change as well. So doing some research, I came across so Nancy Lorenzi's Managing Technological Change, because as we said in earlier, so much is put on technology, but we forget about people. You know, Dr. Aldrich talked about processes, and now we also need to really bring data and information to the forefront as well. So really begin to think about this term called information ecology. The term evidence ecosystem was actually a series of articles in the Journal of Clinical Epidemiology. But information ecology has been around since the 90s, but for some reason, health sciences has ignored that term, which I cannot understand, and which also prompted me to submit a commentary to a journal, which I'm hoping will be accepted, So this is what's actually happening in the literature. We've got terminology after terminology after terminology. So whether it's information, it's based, it's informed, and we're going to talk about the augmented intelligence towards the end. And what's missing here is I just tried to get balance. But knowledge translation is also another term, and that's missing as well. So if you're familiar with Ian Graham's work out of Canada. So we've got a lot of terms, and really trying to figure out what am I? What is my unit? What is my department? You know, as a manager or an administrator, trying to figure out what exactly are we doing here? Where do we fit within the ecosystem? You want to talk about the decision making?
Yeah, so we think about this not just from a clinical practice problem-ish realm, but also from an operational decision-making realm. So that's where we are not differentiating, using the evidence to make decisions across the board. So evidence-informed or evidence-based decision-making can be just as much focused on operational issues like new care models. So a couple of ways that we've used that in the last couple of years at Vanderbilt has been, we did a search and summary of the literature on team nursing. And team nursing is a concept that's all over the literature, but is it ever defined the same way? So what we could do was synthesize the literature around what aspects of a team did we find. So we could synthesize around, you know, what we saw most frequently. And most frequently it was a nurse and then an either unlicensed person or an LPN or a vocational nurse. And so we synthesized everything around there. But then what was important to have in team-based care? So good communication, good training, good competency, good relationships, good handoff, all of those things. So that's an example of evidence formed in decision-making. And we're really thinking about it as not just something that we do when we're in school or when we get out of school, but it's the way we solve problems. They're problem-solving approaches.